Ambulance drivers in eastern India held a rally raising awareness for the country's devastating COVID-19 surge. They urged people to follow safety protocols, saying they would help patients around the clock. India reported its fourth straight day of more than 400,000 cases. More than 4,000 deaths also reported. In addition, there have been more than 240,000 deaths in total. Countries around the world are now assisting by sending in aid. For a closer look at the impact of the pandemic that it's had on frontline workers and their patients, we're joined by Dr. Gautam Harigovind. Now, he is a medical team leader of Doctors Without Borders and their emergency intervention in Mumbai. Welcome, Doctor. Let's talk about this. We understand you're just coming off your shift. Can you tell us what your day's been like?
Yeah, I'm 2 hours post-shift right now. I was actually I just kind of had a nap. It's been a good day actually today. We were able to see a good response from our patients with the kind of treatment we were providing. Also, there was a good sense of teamwork around. So it's been a good day today. I went in at 8 a.m. and I came back around 2:30, 2:45. Yeah.
You say a good day, but of course a bad situation overall. What is the challenge for you and your team?
At this point, we are looking at it on a day-to-day basis. When the second wave hit and when we started seeing a surge of cases, we are based in Mumbai. The team is based in Mumbai, and Mumbai is kind of the epicenter of the pandemic. So the surge happened here first. And we were here to see what was happening. There was a steep rise in cases. We were not struggling for oxygen, the center where we're at, but we were struggling for beds to be able to accommodate all the patients who came in. There was many times when we had to turn people away, tell them that we don't have space for you. Yeah.
It's, as you say, the epicenter, arguably. You have a tremendous number of patients. It's very warm there right now. You're wearing protective gear. What are the challenges like for you day to day?
Heat is a major factor. We keep bringing this to the authorities. We need to improve the conditions for the healthcare workers. The Ministry of Health says 6-hour shifts 4 times a day, but we as the Doctors Without Borders team, we do anywhere between 8 to 10 hours, depending on the needs of the patient and the needs at the moment. We kind of see the emergency area, and the challenge during the surge was the sheer number of cases, also the kind of age distribution, tilting more towards the younger age group, presenting in severe disease. Presenting to the emergency in quite late stages of the disease, and how we were trying to cope with that. Also, deaths would just happen. You would have deaths in the ward. We were kind of understaffed in the beginning. Now we are able to get to every end of the 1,000-bedded hospital that we're a part of. But in the beginning, really, there was just too much to do in a day, and when you prioritize younger patients, you find that, or prioritize some patients, you find that other patients you can't get to, and there was a lot of chaos in that regard.
As a doctor, you, of course, are dedicated to saving lives. What is it like to be in a position where you have to make those sorts of decisions about who can be treated and who can be saved?
It's not good. It's not easy to make any sort of decision on. It's not for us to say who decides to get a ventilator, who decides who we prioritize for a machine or for oxygen or for more dedicated care. And I really don't like for any person to be, to have to make that decision. But then you do, and then it changes you a little, and in small increments, you keep changing. All of us have changed as a team. and I don't know how permanent that change is going to be, and how it's going to affect us going forward as healthcare workers and as human beings. We really haven't had the time to sit down and reflect on these thoughts. I'm a bit more aware because it falls on me as the clinical team leader to take a step behind and assess where we are as clinicians, as human beings, and as a team, and all these things. So yeah, it's quite challenging to find some people express their views in harder ways. People who have joined the team 1 year ago, they were chosen for a certain soft touch in their personality, and now they've molded themselves, kind of gone into a shell. They're protecting themselves, and it's difficult to see.
You mentioned the change, and I don't want to delve too deeply into that, but can I get you just to reflect on how that change inside you feels?
If I was going to speak about my personal experience, I do step in certain emergencies, and it so happens that it feels like I'm watching myself do something. I'm kind of detached. That would be the philosophical way to put it, I suppose. I'm detached. I have to make these tough decisions. I take a step back and I watch myself do these things.
We've seen a number of countries around the world send aid, send equipment. Can I ask you, from the standpoint of a doctor who truly is on the front lines and, as you say, making very difficult decisions, what is it that you need most right now?
Solidarity. I would look at it in two ways. One, for people to speak up and to say, to point out that we need to be prepared. This can happen in any densely populated country in the world. And we need to point out the fact that emergency preparedness is very important, not just for COVID, but for a health system as a whole. The second thing is to show solidarity with the healthcare workers. I know many countries, COVID has been here for long enough, many people want to move on, but there are still people on the front lines of this. And you can show solidarity by social distancing, by wearing a mask, and also by sending us your thoughts and prayers from wherever you are.
Dr. Harigovind, I want to thank you for your time, and we wish you the absolute best for the work that you're doing.
Thank you.
Thank you so much. Gautam Harigovind is a medical team leader for Doctors Without Borders emergency COVID intervention in Mumbai, India.